Good evening. I'm DK Rostow. Welcome back to the TTT News. We are entering the review phase of 2020 and we are starting with the ideal guest, Minister Terrence Deyalsingh, to address policy issues including views of the fight against COVID-19 to date and operations of the traditional healthcare system. Thank you so much for joining us, Minister.
Thank you, DK, for having me. And very Merry Christmas to you and all your listeners and viewers, wherever they are.
Thank you so much. We want to start off with your opening thoughts on the year 2020 from your position as Health Minister, please.
Well, 2020, what a year. What a year it has been for the world, for the CARICOM region, and for Trinidad and Tobago. It was a year of unprecedented challenges, but I thank God that this country is led by a scientist in the person of Dr. Keith Rowley, who believes in science, and who supported all the scientific advisors at the Ministry of Health. And that is why we were able to treat with COVID as successfully as we have done and to end the year on an undoubted high with our lowest level of cases practically for the year. And when you consider what the rest of the region and rest of the world is going through, we are in an excellent position to start off 2021 in a much better place than others.
And now, this battle is won in inches. What kind of policy decisions do you think, if made a little earlier or a little later, could have radically altered the status of COVID-19 in Trinidad and Tobago?
That is a question that I have been asking myself for months now. Because as we know, hindsight is always 2020. But DK, let me put it this way. Based on all the information we had at the time that we made decisions, and even looking forward into time, I think all the decisions we took were the correct ones and timed correctly, including closing the borders. And let us look at other countries that did not act as wisely as we did, where the economies had to go between a series of lockdowns and openings, and they were yo-yoing and seesawing. Look at what is happening to England now. England in the past 24 hours is literally cut off from the rest of the world. We are not in that position because the policy decisions we took, the major one being closing of the borders and letting people in, in an organized way. Granted, not everyone can come in. But look at what is happening in England and other countries near and far who did not take that type of position that we took. So, in hindsight, I think we took wise decisions based on the information we had at the time, and I basically have no regrets in recommending the policy positions.
And you just said policy, you ended your response saying policy positions, and I want to reiterate and underline the fact that we are speaking to you about policy in the main, and this
Correct.
is a prelude to discussing more technical aspects, which will be done with the CMO. So we're doing it in nice bite-sized chunks. And once again, we thank you for being present or making yourself available to this. But the pandemic, how has the pandemic underlined the importance of communication between the policymakers and the technical experts and the policymakers? You also spoke about the Prime Minister being a scientist and drawing on the science and getting that evidence-based research to determine how it goes forward. But how important is that communication? Because sometimes silos are a thing that can take place. But to you, how important is it?
Yeah, so it's much more than communications. While communications is important, but I think the communications we had between the technical persons led by the CMO, myself as a policy maker, and the cabinet and the Prime Minister was more or less seamless. But more than communications, it has to do with trust. The Prime Minister trusted his Minister of Health, the Minister of Health trusted the technical persons, and between those three parties and the cabinet, there was total trust. So the trust and the communications, in my view, went hand in hand. And that is why we were so seamless and so successful in the handling of this pandemic.
And I think this is a beautiful opportunity to give you the opportunity to praise the work or to acknowledge the work which you have done but acknowledge the work of our health workers in Trinidad and Tobago.
Yeah, so even before COVID, whenever I went to visit hospitals on Christmas Day for the past 5 years, I will always say I come to the hospitals on Christmas Day, Boxing Day, and New Year's Day to identify with healthcare workers. I am on record as saying that. And I keep telling them, if you could work on Christmas Day, I could come out and support you. We have an excellent group of healthcare workers in Trinidad and Tobago, from doctors, nurses, patient escorts, lab techs. I mean, everyone, radiology. We have, and I have said this before the pandemic, we have one of the better healthcare systems in the world. It is free, but underappreciated. And it took this pandemic for people to understand and appreciate what we have in Trinidad and Tobago. And our healthcare workers stood up to the challenge and rose to the challenge. And they have my undying gratitude.
And with regard to that gratitude, how proud were you to show Trinidad and Tobago how our nationals have represented the best of us? Because we're looking at individuals who are competent, informed, a wide demographic across a broad range of disciplines. What kind of significance do you think that is in terms of showing Trinidad and Tobago, we can do this, this is capable, look, we are doing it now, in the face of this?
Yes, and you know, the words of the Honorable Prime Minister ring loudly. He always said at press conferences which he led, that Trinidad and Tobago made an investment in the young people, in education. And that investment is now paying off. From the chief medical officer to nurses to pharmacists. He always says that we invested in young people and now we are reaping the rewards of that investment. So it's a source, it should be a source of pride for us in Trinidad and Tobago that our homegrown nationals rose to the challenge.
And I guess it's also good to have different voices, different informed voices, because sometimes when we hear the same person, I can imagine some people, oh gosh, the health minister again, boy, what are you going to say? So as opposed to saying that, you have someone else coming, a specific person dealing with this area, able to speak to that area.
And you hear that is why over the past 2 to 3 months, if you notice, I took a back seat at the press conferences. There was a time when as minister, I was there every day. And there was a time and place for that. But if you notice, over the past 3 months, I took a backseat and I displayed and paraded a group of individuals and professionals, not only from the Ministry of Health. I also brought people from the University of the West Indies, Professor Carrington, Professor Simangal. We brought people from the RHAs, nurses, to speak to the country. So you were getting the messaging not only from the Minister of Health. There was a time and place for me to be there. But now I am so proud of everyone who has educated the public. And it's only for that buy-in of that education we are ending the year with the kind of low numbers that we are seeing at this point in time.
And we want to take a short break on that point of pride. When we come back, we continue speaking with the Minister of Health, Terrence Deyalsingh. Stay with us. Welcome back. We are speaking with the Health Minister, Terrence Deyalsingh, about the year 2020. And Minister, you just spoke about, before we went to the break, you spoke about taking a back seat and being proud and confident that there are people who are there. You do not need to be the face. You can do other things because they're competent individuals to do it. Now, you have become a familiar face to the point of some people calling you Uncle Terry and seeing a little more of you in terms of asking you how you deal with some of the stresses, how you deal with some of the challenges. People would have been smiling, looking and seeing, but wait now, the minister have an authentic hand with regard to playing Tassa. This is in the beginning of August. But have you had some challenges drawing a line between personal and private life, knowing that arrows will come, as well as the sincere plight of people directly appealing to their uncle? Have you had issues or challenges dealing with that line and saying, okay, well, I need to deal with myself as well, because you can't pour from an empty cup?
Correct. So thank you. Look, when you are in public life, even though nothing prepares you for handling a pandemic like COVID, so even before COVID, once you enter public life, you are going to be the subject of criticism. You can't get into this thinking you are going to escape. But COVID did present some challenges, but I must say, with the support of people like my wife, my family, my faith in God, the staff, it made that burden so much less that I was able to focus almost exclusively on running not only the COVID health response, but also at the same time, the regular health response. Because DK, many countries near and far, their traditional health systems collapsed under the weight of COVID. We kept both systems going, and at no time was any of the health systems, the COVID and the non-COVID health systems, seriously challenged. There are countries where women giving birth can't get a bed. There are places where people needing treatment for their diabetes, surgeries, can't get it because their hospitals have literally collapsed under the weight of COVID. So with the help of my wife, my family, my faith in God, and the support of healthcare workers, we have been able, and I have been able to come through this relatively unscathed.
Has it been hard sometimes pulling back some of the "I told you so" rhetoric that you might want to from time to time in terms of saying, okay, well, we need this parallel healthcare system so that the traditional one can remain flowing the way it's supposed to?
Yeah, at the start, when I started to flesh out the parallel healthcare system in January, some people thought I was crazy. But when I studied past epidemics, starting from the 1918 flu, the 2009 flu pandemic, and lessons coming out of Ebola, it was clear to me you could not treat. And what was then, not even a pandemic, it was the beginnings of an epidemic. It was clear to me back in January, February, that this thing had the potential to become a pandemic. And if it became a pandemic, you could not rely on your regular health structure to deal with it. So I think, going back to your first question, all the decisions we took at that time turned out to be the correct decisions in the end, including the setting up of the parallel healthcare system.
And has the experience of 2020 given you some lessons in terms of how the traditional healthcare system is run? Because I know in tandem, or as we say parallel, while we are dealing with COVID-19, there is the issue of NCDs and other things that still need to be addressed. So are there things that from one side have helped with the other?
Yeah. So one of the lessons that the pandemic taught us in many other countries, not necessarily in Trinidad and Tobago, is what you call inequities in health. You saw in particular countries where minority groups, blacks, natives, brown people, Indians, were disproportionately affected by COVID. We didn't see that type of response here because our free healthcare system is equitable, it is accessible. And I think that is a great thing about our healthcare system, and which I have been consistent about. It is unappreciated and underappreciated. But I think people now have recognized that whilst we have challenges in health, and no healthcare system in the world is perfect. Even Germany, which boasts of the best healthcare system in the world, is now crippled. We are nowhere near that. And I give thanks every day to our regular healthcare system. You know, it is such a wonderful system that it is incomparable to anything else in the world.
And I'll give you the opportunity to put in a plug for individuals who need their checks or to go in on scheduled visits to do so at this point in time. Because it's something that you've said in the past, but offering you the opportunity to do it now.
Yeah, so what we want to encourage people, especially with Christmas time, where people tend to overindulge in eating and drinking and come off their medication and do exercise. Now is not the time to do that. Now is the time to stick to your medical appointments, stick to your medication. Yes, you must eat and drink a little bit, but don't overdo it. So you can start off 2021 not needing a hospital bed. That is a key piece of advice. Keep your appointments to get your blood glucose checked, your high blood pressure checked, your cholesterol, and get your total blood work. As a matter of fact, I'm doing mine tomorrow because I missed 2 appointments in 2020, my 2 6-month checks because of COVID. So I am doing mine tomorrow, and I urge everyone to take care of their health and get their checkups.
And you started that in terms of saying sometimes people overindulge, and it reminds me of someone I heard her saying once, because she's diabetic, but she says, when I feel for the ice cream, so I eat till my head get numb, and then I boil my bush. But at the same time, it reminds me that sometimes too much of one thing is definitely not good for anything. But your history as a pharmacist, though, it kind of helps blur the lines between policy and technical. Speaking about the vaccines that we hear of. And so I'd ask you to outline the process of determining what vaccine TNT would eventually use and why. And I mean, some parents may also be wondering, since there have been conversations that will their children need a vaccine before returning to school? So is there a policy decision on that as yet?
Okay, so thank you very much. So the decision to bring any vaccine to Trinidad and Tobago is going to be a 3-step or a 4-step process. So let me explain. There's something called a TAG group, TAG, Technical Advisory Group. So WHO has a TAG group, Technical Advisory Group. They will make recommendations. Then PAHO has a TAG group for the Americas, where we fall under. They will make recommendations. And then locally, we have our local TAG group, Technical Assessment Group, that will make the final recommendation for a vaccine for Trinidad and Tobago. That group will be chaired by the CMO. It will include local professionals, other stakeholders like the University of the West Indies, other virologists. It will include agencies like CARPHA. So that is how the decision will be made, starting from WHO making global decisions, PAHO making regional decisions, and our local technical advisory group, or TAG group, making the final recommendation for vaccines for Trinidad and Tobago. On the question for vaccines for children, the current recommendation, and I confirmed this with the CMO this morning, the current recommendation as of Monday, the 21st of December, is that the vaccines like Pfizer, Moderna, and so on, are not recommended for children under the age of 16. So that is the current recommendation, because trials were not done on that age group. So there is no requirement as yet that when schools reopen next year that you must have your COVID vaccination to go into school, because the vaccines have not been cleared yet for the pediatric population. So thank you for raising that issue.
All right, thank you very much, Minister, for taking the time. And we once again wish you the best of the season. And we want to thank you for tuning in on behalf of the entire news team. I'm DK Roster. Have a good night.